All right, to open our program, we have first Dr. Raylene Reimer, who will speak about our gut health and its importance in our joint health. Dr. Reimer is a professor and interim dean in the Faculty of Kinesiology at the University of Calgary. She holds a joint appointment in the Department of Biochemistry and Molecular Biology in the Cumming School of Medicine and is a full scientist in the Alberta Children's Hospital Research Institute. She is also a registered dietitian. Dr. Reimer's research focuses on diet and how it can be used to manage chronic diseases like obesity, diabetes, fatty liver disease, and osteoarthritis. She is particularly interested in gut health and how dietary fiber can be used to feed healthy bacteria in the intestine. Dr. Reimer has published nearly 200 papers, and in 2021, she received the Earle Willard McHenry Award for Distinguished Service in Nutrition from the Canadian Nutrition Society. Ladies and gentlemen, please welcome Dr. Raylene Reimer.
Well, good morning, and it's a pleasure to speak today on perhaps a topic and two areas of the body that might seem disjointed. Little pun, the gut, or our intestinal tract, and our joints. So I'm going to jump right in and ask you to consider whether you think of bacteria as a friend or as a foe. And in the late 1800s, it was discovered that bacteria can cause infections. And it wasn't until 1928, with the discovery of penicillin, that we actually had an effective way to treat these bacterial infections. And in fact, before we had antibiotics, 90% of children with bacterial meningitis actually died. So antibiotics soon became recognized as life-saving drugs, and their use became widespread. But if we fast forward to about 20 years ago, we started to see some alarming trends emerge. And this was that with increased antibiotic use, we saw it coincided with increased risk or increased incidence of childhood asthma and obesity. And so while the infections were decreasing, chronic diseases were increasing, which led researchers to begin to rethink about our relationship with bacteria. And perhaps bacteria are, in fact, good for our overall health. And so today, we recognize that all of these bacteria and other microorganisms that live in and on our body, and we call these the microbiome, actually have a very important role to play in our health. And if we think about these 40 trillion microorganisms that live with us in our body, the majority of those would be bacteria, and a very large proportion of them would live in our intestine, or what we just call the gut. And so we know these bacteria do many important and beneficial functions or activities for us as the host. And so these can include breaking down dietary fiber. So without bacteria, we wouldn't actually get any benefit from fiber. So they help us get benefit from dietary fiber. They produce some vitamins for us. They train our immune system, which is incredibly important when we are infants. So we are born with a very immature immune system. And it's these bacteria, particularly in our gut, that help to train that immune system to be appropriate in its responses as we grow. It can suppress the growth of pathogenic bacteria, or these bad bacteria that can really cause disease and different conditions in the body, helps with keeping our intestine moving, motility, and intestinal function. And they actually are involved in drug metabolism, so maybe activating a drug so it works in our body, or breaking down and helping to get rid of and eliminate drugs. And interestingly enough, again, very far removed from our gut, it can actually affect our mood. So all of these wonderful bacteria, this community of bacteria, do great things for us. But what we know is that this microbiome, this community of bacteria, can actually become imbalanced as well. And that imbalanced microbiome can lead to disease. And so what we know, I'll just give you an example of how this could actually affect different diseases in the body. So, for example, if we eat a lot of sugary and fatty foods, this can change the types of bacteria that live in our intestine, and they can become altered and imbalanced. And when this happens, the intestinal tract is affected, and so our intestine is actually a barrier between the outside world and what's allowed to get into our bloodstream. And so when the bacteria becomes imbalanced, this nice barrier can actually become leaky. So you may have heard this term, leaky gut. And so what this allows is some particles from the bacteria, or maybe bacteria themselves in some cases, to actually leak through our intestinal cells and get into our bloodstream. And when that happens, those particles from the bacteria can trigger inflammation in the body. And that can go to many distant sites in the body. So it can affect our brain, it could affect our adipose tissue where we store body fat, or the liver, and perhaps also our joints, which we'll focus on today. So if we know that the gut microbiome is really important in health, then the next question really becomes, well, what factors influence what that bacteria, that community, is actually going to look like? And one of the major factors is diet. It has a tremendous impact on what our gut microbiota is going to look like. And of course, we'd like to eat the foods that create this nice relationship between us and the bacteria and promote health in us. And one of the best foods that you can consume to feed your healthy gut microbiome is dietary fiber. So the bacteria love fiber, and the healthy bacteria will flourish on a diet with lots of fiber in it, including whole natural foods as well. But, of course, over the past several years, researchers have also discovered food that can disrupt our, or cause an imbalance in our microbiome. So these include, as I've mentioned, sugary and fatty foods. All those things that taste really good can fall sometimes into that category. Artificial sweeteners have been identified. Dietary emulsifiers. So these are additives that are put into foods like ice cream or desserts and make them really nice and creamy, but can also in higher amounts disrupt our microbiome. And then something called ultra-processed foods. So if we think about a food in its natural state, say like corn, and manufacturers take that original food and add a lot of ingredients to it, maybe some sugar, some fat, and really change the form of that food into something that's packaged, that would be an ultra-processed food. So in addition to the foods, we also have quite a bit of focus in the recent years on something called the prebiotics and the probiotics. And these are known specifically for their benefits on our gut microbiome. And probably more people are familiar with the term probiotics. So this is when you consume the bacteria, the healthy bacteria, directly. So a lot of people would be familiar with probiotic supplements, so this would be in a capsule form. You can also get probiotics in certain yogurts, where they have added the healthy bacteria. But as well, fermented foods and drinks. So we could think of sauerkraut, or we could think of fermented dairy called kefir. And all of these can provide to us these healthy bacteria. And one of the major questions, that very common question, is, well, which probiotic should I be taking? And that's an excellent question, because they're not all the same, and they don't all have an impact on the same thing. So I won't go into details. We could perhaps talk more in the Q&A session, but the International Scientific Association for Probiotics and Prebiotics have come out every year and updated a clinical guide to probiotic products that are available here in Canada, in our grocery store shelves, our drug stores, health food stores. These are all evaluated according to scientific evidence, and we can go there and look which one might be most appropriate. So if probiotics is eating the bacteria themselves, then prebiotics we can think about as the fertilizer to feed the healthy bacteria that already live in our intestine. So this is the food to feed the healthy bacteria. And we can get this in certain foods, so onions, garlic, artichokes. These would be kind of the foods that would have a natural content of prebiotic fiber in them. But if in your future you don't see days filled with eating onions and garlic, then there is also supplement forms of prebiotics that can be taken, and this is typically in a powder form, and inulin and oligofructose would be two common prebiotics. So let's think about this now in terms of the microbiome and its influence. How might it influence osteoarthritis? So as I mentioned, we can have the intestine become leaky and inflamed. And when that happens, these microbial chemicals or their metabolites that they put out, or the bacterial particles themselves, could get to the joint and trigger inflammation and potentially eventually lead to joint damage. So if we would like to interrupt that cycle, what might that look like? And so my lab has been very interested in our research to look at, could prebiotics, by improving the gut microbiome, maybe have a beneficial effect on the knee joint, which was what our interest was, is knee osteoarthritis. So what we did was test the effect of a prebiotic fiber supplement on physical function and pain in adults who had knee osteoarthritis, as well as an elevated body mass index. And the reason we enrolled participants into our study that had extra weight is because we know that overweight and obesity can be a significant risk factor for osteoarthritis. And so these were adults 30 to 75 years of age. They either had to take, they were randomized to a prebiotic fiber supplement or the sugar pill, the placebo. And for 6 months, they consumed that. And what we were most interested in, our primary outcome that we really wanted to look at, was what is their physical function and does it improve? So we did a number of tests before they started the supplement and after. And I'm just going to very briefly tell you what some of the changes that were seen in those participants. So these are all very relevant for activities we do in daily life. They did a 40-meter fast-paced walk. So how quickly can you walk on this loop that we had there? Another one, can you get up out of a chair and walk 3 meters and turn around and come back, sit down? And how fast can you do that? Another one is a hand grip strength test. So squeeze as hard as you can on that instrument there, and we can test how strong your grip strength is. And another one, we just asked them, okay, you have 6 minutes, just go out and walk as far as you can in those 6 minutes. And so we measured that before and after the supplement, and with the prebiotic supplement, we saw within those participants an improvement in all of those factors. And probably most important to the participants was they also reported that had a reduction in pain as well. So to conclude, I would like to say that this is a new area of research. There's likely to be more applications for osteoarthritis to come. I think it's very important that we don't want to overpromise. So it's a supplement, those improvements we saw in physical function were meaningful, but it didn't completely restore them to a young, healthy individuals. So we don't want to overpromise, but we think there's some great potential that might come out of this area of research, or linking the gut to our joints. And my take-home message for you is, for all of us, irregardless of our age, is to eat more microbiome-friendly foods, so more fiber-rich foods. Some examples could be apples, more broccoli, berries are a fantastic source of fiber for us. And then maybe concentrate specifically on foods that have prebiotic fiber, the unique type of fiber. So onions, asparagus, artichokes are all very good there. And then more fermented foods. So we need to get more bacterial back into our body. We've over-sterilized a lot of things, so yogurt, sauerkraut, kefir. And I will leave you with my favorite saying, healthy gut, healthy life. And perhaps, as the research goes, we could maybe add to that healthy gut, healthy knees, and maybe healthy gut, healthy hips. So maybe that will catch on one day. So thank you very much.